You go to bed after a long day. You're tired. You're ready to sleep. But the moment your head hits the pillow, your feet start burning. Not a little tingle. Not slight discomfort. A deep, hot, crawling burn that shoots right through your heels, your soles, sometimes all the way up to your toes. And no matter how much you kick off the blanket or press your feet against the cool wall, nothing seems to stop it. If that sounds familiar, I want you to know something important right now. You are not imagining it, and you are definitely not alone. Millions of people, most of them over 40, deal with this exact problem every single night. But here's what makes it worse: most of them are doing the one thing that's quietly making it worse. And today, I'm going to show you exactly what that mistake is. So let me paint a picture for you. You're sitting with your family after dinner. Your feet feel fine, maybe a little tired but fine. You do your evening routine. You brush your teeth, get into bed, and for a few minutes everything is okay. Then it starts. First it's warmth, then it's heat, then it becomes that unbearable burning sensation that makes you want to peel your feet off your body. You try moving your feet. You hang them off the bed. You fan them with a book. You check if maybe the room is just too warm. But the room isn't warm at all. The burn is coming from inside. And the worst part, in the morning it stops. You wake up and your feet feel completely normal. So you brush it off. You tell yourself maybe it was nothing. Maybe you just need more water. Maybe you were just too stressed. But then the next night it happens again. And the night after that. And this cycle repeats for weeks, sometimes months, sometimes years. People live with this. They adapt to it. They lose sleep over it literally. And most of them never find out why it keeps happening. Now here's where I need to stop you for a second. Because there's a very common belief about burning feet that I hear all the time, and it's flat out wrong. A lot of people think burning feet at night is just normal aging. They think, I'm getting older, my circulation is slowing down. This is just how it is now. Some people even think it's just dry skin or tired muscles from standing too long. And doctors, even well-meaning ones, sometimes dismiss it as stress or poor sleep posture. So people go home, take a painkiller, maybe rub some lotion on their feet, and call it a night. But here's the truth. Burning feet at night is a signal. A specific signal. Your body is trying to tell you something is off. And when you ignore that signal, or worse, when you do the one thing most people do that makes it worse, you're not just dealing with discomfort. You're allowing a deeper problem to go unaddressed. And that can have real consequences for your health down the line. So here's what I'm going to cover in this video. First, I'm going to explain exactly what causes that burning feeling in your feet at night in simple, plain English that actually makes sense. Then I'm going to walk you through the most common reasons it happens, and there are several, so pay close attention because one of them might surprise you. After that, I'll reveal the number one mistake most people make that keeps this problem alive. And finally, I'll give you a clear, practical action plan you can start using tonight to get some real relief. Stick with me to the end because the last point I'm going to share is one that almost nobody talks about, and it might be the most important thing you hear all day. Before we go any further, drop a comment right now and tell me, does this happen to you in both feet, or just one? Just type both or one down below. I read every single comment, and knowing this actually helps me understand what you might be dealing with. So go ahead, I'll wait. Okay, let's talk about what's actually happening inside your body when your feet burn at night. Think of your nervous system like a network of electrical wires running through every inch of your body. These wires carry signals about temperature, pressure, pain, and sensation back and forth between your feet and your brain. Your feet are at the very end of that network. They're the farthest point from your heart and your brain. So when something goes wrong with those nerve wires, whether it's inflammation, compression, nutritional deficiency, or poor blood flow, your feet are usually the first place to feel it. And the sensation it creates, that burning, tingling, hot feeling you get at night. Here's why it gets worse at night specifically. During the day, you're moving around, you're distracted, your brain is focused on 100 other things. But at night, when everything goes quiet and still, your brain suddenly has nothing else to pay attention to. So it turns up the volume on those nerve signals. The sensations that were background noise during the day become a loud, burning alarm at night. Number 1, peripheral neuropathy. This is the most common cause of burning feet at night, and it's also the most misunderstood. Peripheral neuropathy just means nerve damage in your outer limbs, your hands and feet. Those electrical wires I mentioned, when they get damaged or irritated, they start sending wrong signals. Instead of sending a normal everything is fine message, they fire off false alarms, burning, stinging, or pain signals even when nothing is physically wrong with your feet. What causes nerve damage? Diabetes is the number one cause. High blood sugar acts like acid on your nerve fibers over time. But it's not just diabetes. Alcohol, certain medications, vitamin deficiencies, and even chronic stress can slowly damage your peripheral nerves. The scary part is that this damage is often silent for years before you notice it. The burning at night, that might be your first real warning sign. Practical tip: if you have diabetes, even prediabetes, and you're experiencing burning feet, please talk to your doctor soon. Early nerve damage can be slowed down significantly if caught in time. Number 2, vitamin B1 deficiency. This one flies completely under the radar, and it's more common than most people think, especially in people over 50. Vitamin B1 is like the insulation around your nerve wires. It protects them and helps them function properly. When your B1 levels drop, that protective coating starts to wear thin, and when your nerves lose their protection, they start misfiring. The result? Burning, tingling, or numbness, most noticeably in your feet. Think of it like an old electrical cable, where the rubber coating is cracked and falling off. The wire still works, but it sparks and shorts out constantly. That's what's happening to your nerves when B1 is low. And the worst part, B1 deficiency gets more common as you age because your stomach produces less of the acid needed to absorb it. People who take certain acid-reducing medications like omeprazole are at even higher risk. If you take those regularly, this point is especially important for you. Practical tip: ask your doctor for a B1 blood test. It's a simple, cheap test that most people never get unless they specifically ask for it. Number 3, poor circulation. Your feet need a steady flow of blood to stay healthy. Blood brings oxygen, nutrients, and warmth to your tissues. When circulation is poor, whether from heart issues, sitting too long, or arterial problems, your feet don't get what they need. The nerve endings and tissue in your feet can become irritated, inflamed, and oversensitive. The result? That hot, burning feeling, especially at night, when you're lying still, and blood flow slows even further. An easy way to think about it: imagine a garden hose that's been partly kinked. The plants at the far end don't get enough water. They dry out, stress out, and start to wilt. Your feet, when circulation is poor, are those plants at the end of the hose. Practical tip: elevating your legs slightly while you sleep, just a small pillow under your ankles, can help improve circulation to your feet overnight. Number 4, athlete's foot and fungal infections. This one is more straightforward, but a lot of people miss it because the symptoms don't always look like a classic infection. Fungal infections can cause intense burning, especially between the toes and on the soles of the feet. The burning tends to get worse in the warmth of bed covers at night. Many people deal with this for months thinking it's nerve-related, when it's actually a simple fungal issue that's very treatable. Practical tip: check your feet carefully for any peeling, redness, or scaling between your toes. If you see it, an over-the-counter antifungal cream is your first step. Number 5, tarsal tunnel syndrome. You've probably heard of carpal tunnel syndrome, a painful wrist condition that affects people who type a lot. Tarsal tunnel syndrome is the exact same thing, but in your ankle. There's a narrow tunnel on the inside of your ankle where a major nerve passes through. When that tunnel gets inflamed or compressed from injury, flat feet, or swelling, it pinches the nerve. And that pinched nerve causes burning, tingling, and pain that radiates into the foot. It often gets worse at night because inflammation builds up throughout the day. Practical tip: if your burning is mostly on the inner side of one foot or ankle, and you also have flat feet or recently sprained your ankle, bring this up specifically with your doctor. It's often overlooked. If any of these are hitting close to home for you, go ahead and hit that like button right now. It takes 1 second, and it tells me you're finding this useful, so I can keep making more content like this for you. And be honest with yourself here: have you been dismissing your burning feet as just tiredness or just aging? If so, what you're about to hear next is really important. Alright, here it is. The number 1 mistake that keeps people trapped in this cycle of burning feet night after night. And when I tell you what it is, you might feel a little frustrated because it's so simple, and yet almost everyone does it. The mistake is this: treating the symptom instead of finding the cause. Specifically, people reach for painkillers, anti-inflammatory creams, cooling sprays, or compression socks, and yes, those things might give you temporary relief. But here's the problem: if your burning feet are caused by nerve damage from diabetes, a painkiller doesn't fix the nerve damage. If it's caused by B1 deficiency, a cooling spray doesn't rebuild the nerve insulation. If it's poor circulation, a compression sock might even make things worse by restricting blood flow further. You are managing a symptom without addressing the root. And while you're doing that, the underlying problem continues to worsen quietly. Think of it like this: if your car's engine warning light comes on, you don't just put a piece of tape over the light and keep driving. You open the hood and find out what's actually wrong. Burning feet at night is your body's warning light. Don't tape over it. The real solution is to identify your specific cause and then address that cause directly. That's what we're going to do right now. Let me tell you about a man named Robert. Robert was 58 years old. He'd been dealing with burning feet for about 2 years. Every night, same thing, couldn't sleep, feet on fire, hanging his legs off the side of the bed trying to get relief. He tried everything he could think of on his own. Cold foot baths, ibuprofens, different socks, even sleeping without any blanket in the middle of winter. But nothing worked for long. He figured it was just getting older. His dad had the same issue. It felt normal. Then one day, his wife convinced him to bring it up at his next doctor's visit almost as an afterthought at the end of the appointment. His doctor ran a few tests. Turns out, Robert had been living with prediabetes for probably 3 years without knowing it. His blood sugar had been quietly damaging the peripheral nerves in his feet the whole time. With the right diet changes, some targeted supplements, and a specific treatment plan, Robert's burning gradually improved over the next few months. He told his wife that the burning at night had become so normalized that he almost accepted it as permanent. He had no idea it was his body screaming for help. That's the story I want you to take seriously today. Your body is trying to tell you something. It's time to listen. Here's your step-by-step action plan. Follow these steps and you'll be moving in the right direction starting tonight. Step 1. Track your symptoms. For the next 7 days, note exactly when the burning starts, how long it lasts, which part of the foot is affected, and whether it happens in one or both feet. This information is incredibly valuable when you talk to a doctor. Step 2. Get a blood test. Ask your doctor specifically for blood sugar and HbA1c levels, vitamin B1 levels, and a full blood count. These 3 things alone can rule out or confirm the most common causes. Step 3. Check your feet carefully every day. Look for any signs of fungal infection, cuts, or swelling. People with nerve issues sometimes can't feel small injuries, so visual inspection is important. Step 4. Review your medications. Some medications like metformin, certain antibiotics, and acid reducers can deplete B1 or cause nerve side effects. Talk to your pharmacist or doctor about what you're currently taking. Step 5. Make the simple nighttime changes. First, elevate your feet slightly while sleeping using a small pillow under your ankles. Second, avoid tight socks or compression wear at night unless specifically prescribed. Give your circulation room to do its job. Step 6. If you are diabetic or prediabetic, prioritize blood sugar control above everything else. Stabilizing blood sugar is the single most powerful thing you can do to protect your nerves going forward. Let's do a quick recap of everything we covered. Burning feet at night is not just aging, it's a signal. The most common causes are peripheral neuropathy, often from diabetes, vitamin B1 deficiency, poor circulation, fungal infections, and tarsal tunnel syndrome. The number one mistake people make is treating the symptom with temporary fixes instead of identifying and addressing the root cause. And the action plan is simple: track your symptoms, get the right blood tests, check your feet daily, review your medications, and make those to small nighttime changes. Your feet have been trying to talk to you. Now you know how to listen. Call to action now. I want to hear from you. In the comments right now, tell me how long you've been dealing with burning feet. 1 month, 1 year, 5 years? You might be surprised how many other people in this community are going through the exact same thing. And your comment might just help someone else feel less alone. If this video helped you see your burning feet in a new way, please hit the like button. It genuinely helps this information reach more people who need it. And if you're not subscribed to the Health Insider yet, hit that subscribe button and turn on notifications. I post new videos every week on symptoms most people ignore, health mistakes that are easy to fix, and real science explained in plain English. And if you want to watch my next video, I cover the 5 silent signs of nerve damage that most people brush off for years. Disclaimer, important disclaimer. This video is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before making any changes to your health routine or if you have concerns about your symptoms. The information shared here is based on general research and is not intended to diagnose any individual condition.